Tell them I don't need to stay.
Were you able to?
This didn't come from the developer, it came from the board of supervisors. I mean, that's.
Are they coming?
You know, I look at that
Do we
differently.
know if they're coming?
Oh, I don't, that's not, I have to put my.
I mean, we've had ones where the developer comes to us and asks for a break.
That's true. That's true.
Pass this down the line, gentlemen.
Well, I'm saying because the airport's renting, they've got right money in. I wanna make sure that our municipal resolution.
Yeah, somebody sent me an email saying, did you know that?
Tell her about the
But I don't think
holiday.
they're coming. I don't know what's going on.
Charlie did.
Linda said she doesn't know, and,
They were trying to convert like vote numbers because CNN didn't.
Yeah, but what I said is if.
Charles
One
mentioned
more
something
thing,
about
and I
Charlie
said,
that call.
say
I
they're
just
not
didn't
coming.
know.
They don't want to, but like, I might.
Good stuff.
Good stuff.
But I mean, they're expecting it to
Yeah.
work out.
Once I saw the numbers, I was like,
Good. I think that hopefully.
yeah.
water,
Yeah, there's still some provisional.
clear liquid.
Oh, it's 5 o'clock?
Money,
Can't get it in the courthouse.
but I think she's gonna raise the score a little bit.
They're coming.
They're coming tonight?
Yep.
Okay, thank you. And is Mr. Myers here, do we know?
He will not be here tonight.
Okay. Do I have I need Mr. Heckman then.
I think so.
No.
And is Peg coming? All right, I'll leave it there.
Gonna have to.
Could we start the Human Services meeting, please? Courtesy of the floor, seeing none. I guess I need to wait for Linda. Do I need to wait for you, Linda? I could do what I want. Dangerous. Okay. We'll start with the introduction of the Veteran Affairs Director. Oh. Hang on, thank you.
Thank you.
Hi.
Hello, good afternoon, council members.
So, why don't you tell us about yourself?
Okay.
I just wanted, seriously, we're not here to grill you. What we did is, we met you at the meeting. People have been asking for someone to come. Unfortunately, Mr. Myers isn't here. I'm sure he'd have some questions or some comments to ask, but Mr. McGee will represent his branch of the service, I'm sure. Both of their service admirably, but just tell us about yourself a little bit and what your hope for the position is. That would be helpful.
Absolutely. As you guys are aware, my name is Alex Carrillo. I've been an employee of the county since 2009. I've been under the Children and Youth Division, and through that position, I advanced myself to a Caseworker 3 position, and then I was also in the Quality Assurance Department under Children and Youth, revising policies and reviewing our vendor contracts that we have to make sure they're following the policies and doing what they need to do. I am also a veteran myself. I served 6.5 years with the U.S. Army. I was mostly stationed in Fort Campbell, Kentucky with the 101st Airborne Division, and I did serve 2 overseas tours in 2002 and 2003. And so I applied for this position because I am sort of a social worker, and I feel that calling in nature, and I like to help people. And being that I'm a veteran, I saw the opportunity to be able to help other veterans as well, and that's what made me apply for this position. So.
Okay.
Yeah, Mr. Carey's not here. I'm sure he had a couple questions. We're both in the Navy, but one of the things we had brought to the attention of the former person in your position was the discount program for veterans in Northampton County. one of the good things that was done was they actually came up with a discount card for veterans. Now, Lowe's and Home Depot have taken it to a new level, but we had, we always tried to, at least I know I did, I had questioned them about it, like, why aren't the companies signing on? Because I think it's like, I think Montgomery County had it first. And then I wasn't on council then, but I think Northampton County modeled that program.
Mm-hmm.
And I didn't understand why you couldn't get the big boxes to sign on or, but that was one of the things I wanted to ask the former, but I never had the opportunity. So I just think that's something, anyway. But that and the other thing is people that just can't find DD 214s, and I'm sure you already know and have a program, and, or whatever. I'm sure the county has some kind of a process that they use.
In regards to the discount program, I know we do have the availability to do those cards for veterans that come in and show their DD 214. Obviously, if they have an issue obtaining one, we would try to assist them with getting a copy of that through the state systems or one of their federal systems that they may have registered their DD 214 into a file. So I haven't received any notices of any veterans like not getting the companies to assist them with the discount program. We have had a few veterans that have come in since I've been in the office, but that's something that I can follow up with and check which vendors or which companies are not signing up for it and not offering that discount to veterans, and see if I can do anything with that.
Well, I appreciate it, and I know you're new to the position, so the other thing, I just wanted to make sure that you get the opportunity to engage in the meetings or whatever that they have. I guess they're virtual now to get that information and to answer your questions, And I was assured, I think, at the last meeting that you were going to have that ability, which, of course, And I just want to make a comment. We were through with, prior to the state putting the flag on the license, prior to that, the Northampton County discount card was really helpful. You could actually show that, because a lot of people, well, how do you carry your DD 214 in your pocket? No, but I had this card here from the county. Oh, we'll accept that. The state finally picked up on it, and now they have the flag. A lot of people are looking for the flag now, so. Just a couple comments. Thank you very much, and thank you for your service.
No problem. Thank you as well.
Any other questions?
Yeah, I had one. Have you jumped out of an airplane?
Not an airplane, a helicopter. They call it aerosol with Fort Campbell. So
Okay.
sliding down the rope from a helicopter, yes.
Oh, cool. All right, anyway, one of the issues we had with the previous director that I believe the chairman raised was the need to develop metrics and keep records. So that's something that I'd hope that you'd be able to bring. Certainly with your background from children and youth, you realize the importance of maintaining the metrics. Then the other thing I had was something that I see I work in the public sector as well. The benefits of purchasing service time, and I guess that's something that we don't hear about enough. If you are, in the public sector, I would encourage veterans to purchase their service time as soon as possible. Because I've had former service members that I work with that, they're my age and they're thinking about going back, purchasing their service time, and they realize how expensive it is because it's based on your age and that. So I guess that's something that I haven't heard talked about, but it's something that's come to my attention because of people that I work with, that they wait so long to do that. And I think that that's something that we need to encourage, especially our employees when they take a job here with Northampton County, to purchase that service time as soon as possible. So I'd appreciate you looking into that, and I thank you for your service.
Anyone else? Mr. Heckman?
Yeah, thanks for coming, Alex. I mean, I know you just started.
Thank you for the invite as well.
Yeah, and I'll probably come out after you've gotten yourself acclimated, some months after the year, whatever. come out and see how things are going or what, like to visit. I agree with what everybody said. I think in a really positive and good way, I think one thing is almost like a tour guide for veterans in the sense that I know, and I've said this before, because the veterans I've talked to, it's very confusing sometimes. And, we have a Veterans Affairs office at the county, but they don't realize that we don't necessarily have, but you can be a conduit and a very big help to help people out. And at times through our history, I think that's worked, and at other times it hasn't worked so well. And so I think that just that in and of itself is a big, big thing, at least the feedback I got. And I guess the other thing would be the flags. Is your office still doing the flags for the cemeteries?
Yes, we are.
Okay. Do you coordinate with the VFWs yet to do that?
We usually, from my knowledge, we usually around January of each year. I guess the bids get put out for the purchasing, and then there is a group that with other counties, I believe, that we order the flags as a group.
And usually, I mean, they used to. Now I know some of them are having their own issues with memberships, but I would think that might be reversing. That the VFWs would then go out and volunteer to put the flags out on the site, grave sites. Is that? I mean, if I'm asking you something that you haven't found out yet,
I'm not familiar with that.
That's fine. And I just want to say, once again, welcome aboard. And I think it's great that you jumped out of a helicopter. I don't know if what's worse, jumping out of a helicopter or having to deal with Mr. Dertinger, but either way, I think you're up to the task. So thank you very much.
Thank you.
Yes, sir.
One more thing I forgot. When we went over to sign up for over the Human Services Building, we went over to sign up for the ID card. And one thing I just want to make a note, because I think this was really neat, maybe they should advertise it a little bit better. But my father wanted to get his medals, he never was able to. And the woman over there, not only did we get our ID card, but when he mentioned that, she bent over backwards and just like got us all the forms and took everything down. And within like a couple of months, his medals came. So, that was a big deal that some people just don't know where to get them. He's like, I always wanted to get my medals, and she helped her out, so anyway, thank you.
I'll pass the message along to Stephanie. She's great there in the office. Absolutely.
Yes, thank you. He doesn't have to deal with Mr. Dertinger. He has to deal with Ms. Wondolowski, which could be worse. She's a tough cookie. No, thank you for your service. Thank you for your jumping out of the plane and into this position. Because this is going to be harder. But I think, I'm sure you shared with him some of our concerns and some of our requests, but definitely to look for, what I'm interested in hearing about is any problems that you've identified, different levels of service groups that have different problems when we came on. I know I had talked to Mr. Morganelli when he was in his former position, and he had mentioned potentially a need for a veterans court if there's veterans that are homeless or having difficulty. So if you see that, and if there's anything you identify as needs, I would hope you would come back and you would let us know.
Right.
So thank you, and
Absolutely.
and do what you need to do in your position, and serve our guys and our ladies. Thank you very much.
Thank you, guys.
Is there anything you need from us yet? Are you ready? Do you have any?
No, thank you.
Good answer. Okay, report on Health Choices Division. Her first time with us.
Hello. I handed out, I don't know if you got just the Health Choices overview.
You have to introduce yourself.
I'm sorry, what was that?
You have to introduce
yep.
yourself for the folks.
Christy Bernard, Northampton County Health Choices Administrator. I was never officially up here, but I came up here in September or August to present the ORLTSR program. But I also started in children and youth. I was there for almost 15 years. Started as a caseworker, supervisor, and then the program specialist for training before I promoted in 2019 to the Health Choices role. That's okay. Thank you.
Excuse us.
Oh, no, take,
Just want to get that out of her way. Okay. There you go. You're welcome.
So just a quick overview of Health Choices, because it's very different from anything else in the Department of Human Services. We are, as easy as it can be said, is we oversee the managed care benefits for behavioral health benefits in the county of Northampton. So anybody who receives medical assistance that is a Northampton County resident, if they would be reaching out for behavioral health services such as drug and alcohol, mental health treatment, inpatient, outpatient, we ensure that they have access and that they can obtain it. We do this through a contract with a managed care, behavioral health managed care organization, which is a BIMCO. There's tons of initials, and that is Magellan Behavioral Health of Pennsylvania. And we provide administrative oversight of their programming, of any approvals. I work hand in hand. I'm on the phone with Magellan in Zooms and meetings several times a day. My department consists of 5 people, myself, an accountant, a data analyst, as well as 2 quality improvement coordinators. Quality improvement coordinators, I think, are the backbone of the program because they provide oversight. They look at contracts. They go out to the providers. So if they do audits of all the providers who provide those services in the county to the county members. In addition to that, we also, if our spending allows it, we are 100% state funded, by the way. But if we ever have any excess funds, we can put that into reinvestment programs. And that was actually one of the exciting things about the program when I decided to apply for it, because I'm a social worker, a licensed social worker, and I just saw the benefit of that would be able to be introducing new programs that might not fit the traditional role of behavioral health services to be able to provide extra services for the members of Northampton County. One we currently do right now is an affordable housing program that's run through the Lehigh Valley Conference of Churches. And we actually expanded that program since COVID hit to make some of the parameters more accessible for people if they were impacted by COVID-related job loss or income issues. The ORLTSR that we presented on for the forensic housing of individuals who need mental health treatment in order to stand trial, that's our newest reinvestment program. We just recently signed the contracts, and we are waiting on a date for groundbreaking for that program. Other than that, I'll let you guys guide it if there's any specific questions, because it is a very complex, I'm in the role a little over a year, and I feel like I'm still learning things. Our program standards and requirement that we have to follow is over 100 pages, and our contract with the state is 450 pages, our agreement with the state to provide this service. So we actually employ, through contracts, an actuary, an accounting firm to do external oversight. Rich Lieberman is our data analyst, and he does tons of behind the scenes. He has to do reporting to the state on a daily basis, and there's a lot to it. So then insert a global pandemic, changed kind of everything with doing everything online. And we also then put into place some alternative payment arrangements for the providers to help keep some of the Northampton County providers afloat when they were hit with hard times through COVID and not being able to continue providing the services they need. So we continued to pay them what they would have been paid if they were providing what they did the previous year, in order for them to get through this. And hopefully when we get on the other side of the pandemic, we still have enough providers to provide the services that the county members would need.
Any questions? Go ahead.
Mr. Lieberman is a great guy.
Yes.
Okay, so don't let him get away. He's been there quite a few years now.
I think he's been, because I know the county over 30-some years with other roles, but he's, I believe, 18 years, 17 or 18, just in Health Choices.
Yeah.
Yep.
The other thing is, where are you at now with your reinvestment fund? Can you give like an idea of what you have right now?
The plans we are doing?
Yeah, like, I mean, well, I know, you did your contract, then you have your reinvestment that
Yep.
you can put out into whatever.
Correct.
Are you, as you have figure now that you're working with, or?
Not yet. Last year, we did not have any reinvestment dollars, so that would have been for 18-19. Because of how the system works, we pay the claims for all the services and claims. I mean, if you think of insurance companies, it takes a little while until the person actually sees a therapist, they put the claim in, we pay it. So there's always a 60 to 90 day where we don't know where our funds are at 100%. What I will say is it's looking like we will have extra this year. However, the state has already urged us to use that funding to provide provider rate increases so that the providers get more rate increases. They don't want to see as much leftover funds for those type of services. So we are not sure, because the state has to approve any reinvestment plan. It's a huge booklet we have to send to the state when we have an idea. When we had the housing idea, they approved it. It's through 2022. We can always put more money into that, but it's up to the state if they would approve it. So at this point, this year, we don't know. We hope to have some.
Okay. Yeah, thank you.
Yeah.
That's all I was curious about that.
I had a question. It's an interesting jump in numbers from the younger age groups up to the 22 to 44. Are those constituents covered elsewhere prior to getting in that age gap? Or I wonder if they come under any other service categories, or?
They, if it's income-based, they would have always been under that, whether they're with their family or they may have gotten on their own, like moved out of their house, their family household, and then applied for medical assistance that way. Also, if someone, when they turn 18, if they end up applying for disability, SSI benefits, they may have had their parents' insurance as a child, and then maybe they would flip over to an MA-funded program.
Are there any other things that you identify that you may need, or any things that you foresee that may be coming up in the next year or two, since you have the ability to?
Right now, we're working on, I mean, the state is pushing it as well, but my heart is in it as well, coming from children and youth and seeing the social determinants of health. I don't know if you've heard of that term, SDOH. That is all the factors that impact how someone survives. It's housing, it's employment, clothing, shelter, food, things that aren't traditionally covered by behavioral health money, because it has to be a treatment that we can pay for. But the state is actually putting forward some new proposals that they want us to work more on these social determinants of health, which would allow us to use some of our funding to some of the actual funding instead of providing a reinvestment plan to provide those services. Because if people aren't stable in their life in other aspects, they're not able to get their mental health or their substance use under control. So that's one thing I'm looking forward to. But the state, we go through a very tedious rate setting process with the state, a back and forth, and we're still in the process, but we are going to get a slight rate increase. So with that rate increase, we're hoping to be able to expand on that. So at this point, I feel like our department's been pretty lucky in everything to fare well through all this. So not really at this point. Thank you, though.
Anything else?
Yeah, I do, if I may,
Yes.
very quickly. Can you tell me, like, in 1 minute, like, just an overview of how this program works?
Okay. Well, we contract with Magellan, who's the behavioral health managed care organization. They are the ones who credential providers, so outpatient mental health. They have a ton of staff who have different departments who they do provider credentialing, they do claims, data, all different things. So when someone goes to a therapist, on the back of their card, Magellan is the insurance company. They submit that claim through Magellan's system. Magellan sends it over to us. We pay the claim. So that's like the monetary piece of it. But then we also, the county requests, we're involved in, we oversee the decision-making, so if there's ever a delay in claims that someone didn't submit something, I can approve it to be still paid if it was a valid reason. If we find that there's not enough, there's waiting lists for drug and alcohol detox programs, I can reach out to the community, find out if there's other providers who are willing to provide that program, and we can work with them to create a new program to ensure that there's enough access to a certain program. So it's a different facets of it, and because we are within the Human Services Department, I work a lot with the Mental Health Department and the Drug and Alcohol Department and Children and Youth. We have what's called a complex case procedure that if there's a child who is sitting in a hospital, can't find a bed because of their behaviors, we can assist with that. So there's a lot of different facets. Some of it's very boring, claims, money, paying, that kind of stuff. And then there is just making sure there's appropriate programs so that our members can receive the right type of treatment and not come back and have to receive it. There's also a cost savings that we look into, because if we provide the right service up front, that maybe it'll benefit the person and they won't have to come back in and utilize the benefits for a long term. So if that
No,
answers.
that's very helpful. Now, I see
Okay.
where the tool in the toolbox and where you, okay, thank you.
Who determines that it's Magellan?
We do a request for proposal, and we're actually going to be doing a new one in 2021.
As a county, or
yes,
do you
a
do it as
county.
part of the,
It's on our county decision, yep.
oh,
Yeah.
that should be fun.
Yeah. They're also for Lehigh County. They did their RFP last year, and they went again with Magellan. And it just depends on, there's been many counties who have changed, if we can get a better proposal and if they can offer better services. It's cost versus what they can provide as well, and ideas, looking forward into how we can better continue to improve the program.
Do you feel that your constituents were able to receive this service? Because I guess people call you when there's a gap or there's a problem. I'm sure they're like, ah. So how were things during the pandemic? And were they able to get their services? Because I just read something. I got something from OMSAS. I don't know if it was about virtual or allowing to continue virtual. I think they made decisions about whether they would accept those contracts or not, and for how long. So I just wondered if it was seamless or if there were problems.
A lot of it was seamless because a lot of people telehealth was already being worked on, so that a lot of agencies and providers still had the ability to continue to provide those services, but telephonically. So OMSAS waived the requirements of the face-to-face, which allowed people, even though they couldn't leave their home, they could still at least connect with their therapist. The inpatient providers saw a great decrease because people were scared to go inpatient. They were still offering, you could still go, but we had to drop. And probably about in August or September, it started to increase again. We're seeing another drop currently because the numbers are going up again. But because of the telehealth regulations and those things, people were still able to access a lot of the services they need. And if they weren't, if a provider was understaffed because they had people out, we were able to connect them. We have a member family advocate at Magellan, John Lees. He is amazing. I knew him from my children and youth life. And he is like the go-to person. If there's a member issue that we can't resolve, he jumps right in and he's able to find a similar provider. He'll get everything set up. He'll push people in the right direction so that there isn't that lapse. And he has a whole department that he oversees, but he's the
And who determines whether LPCs can see people? Is that Magellan? Is that a Fed requirement?
That's the state requirements.
The state? Because do you know how many more people would have services if they'd open the door to LPCs? I know you're a social worker.
I know.
There was a time
but
we were in competition, but now
Yeah.
I think it's time to open the doors.
Absolutely. And what we're seeing, I think it could be going in that direction. But it's just a lot of red tape at the state level and through the licensing boards and things like that. So that's not in our control.
I didn't think it was yours personally, but I didn't know if it was Magellan or if it was the feds, because they get their money through federal sources, to state to fed.
Yeah, I think it's a state license. Like if the state would allow them to be on one of those provider, like if they're able to credential and provide that service and bill, they could.
Mr. McGee, you had another question, I'm sorry.
Just a comment, that's all, just a quick comment. I watch the news too, and I think you guys got your work cut out for you in the future.
Yeah, it's scary moving forward, it really is, but I do think the state has, we have a weekly state call, and because they were willing to waive a lot of the regulations at this time, people were still able to at least access their services. I mean, that would have been the biggest barrier, because just because people don't want to leave their house doesn't mean that they're even in more crisis right now, so. And it's almost paving the way for more out-of-the-box thinking for how, because some people can benefit for this even when we're not in a pandemic. They could still, if they have certain diagnoses that they don't want to leave their house, they can still at least receive some services.
Okay, thank you.
Thank you.
Thank you very much. Let us know if you need anything. And you've filled her shoes admirably.
Oh,
Thank you for all your hard work. Our friends from Graysdale. Da-da-da.
Long time no see.
I remembered that I wanted to hear about dementia today, so I hope you remember. I was going to call you.
We have case mix index, which you wanted to hear about.
I wanted to hear both.
So while Brian is handing out the report, I wanted to give you some more good news. The government has handed out $2.5 billion in incentive programs for nursing homes over a 4-month period starting in September, and we received $70,000 of that money. And that goes on the ability to keep new COVID infection rate low among residents, and also the ability to keep COVID mortality low among residents. So hopefully we'll see 3 more months of those payments, but it's nice to know we got money for it. So the first page is just going to go over the admissions and discharges. So as of today, we are 534. Over the weekend, we were 541, so census continues to go up. You can see the admissions for this past October was 29, and the inquiries were 146. The discharges were 12 to the home and community, a hospice discharge. Unfortunately, we lost 15 residents, and so that equals 28, so we were up 1. I wanted to go over this because right now there was just an article about occupancy rates. And again, they have, across the country, they have gone down. So the average occupancy rate across the country is 73.8, while Graysdale remains consistent at about 78%. So we are beating the national numbers.
Can I ask?
Sure.
Can I just pause there? So obviously, people call and make the inquiries. Do they ever, I mean, obviously you follow up as well. Do they say, do they give a reason?
There's a lot.
Why?
They want to try home. They're pre-planning, so they're just not ready yet.
Getting the data?
Correct. So we're all ready for them. We just they haven't come in to live. Some are people we choose not to admit. It's a small portion. I would say between maybe 10 and 15 people. Usually it's drugs that we can't have mixing in with the elderly. If they're going through treatment, they should go to treatment first before we can consider them. That's a
You mean drug addiction?
drug addiction, active drug. So hospitals, they go other places first to use their Medicare days, and if they at that time can't go back home, then we usually get the phone call.
Okay. And these are for your residents. This has nothing to do with the short-term rehab, correct?
It includes the short-term
does.
rehab, correct?
I'll let you move on. Sorry.
No worries. Then you go on to the next slide, which is the COVID. So the Graysdale stats is we have had 246 residents test positive, and that is from the beginning in March. Currently, we do not have any. We are still doing the weekly testing because we must do that until we have 14 days clear of any new cases. So that re-enrollment plan that I've been talking about and the chutes and ladders, now out the window, and now we just have to do 14 days of no new cases for residents and staff. So total residents resolved is 171, and unfortunately, we have lost 76. And that number has remained the same since it was in the beginning stages of COVID. Employees have tested positive is 61. 2 weeks ago, we didn't have anybody during our weekly testing test positive. Last week, we only had one. And we just finished testing today for this week. So we'll find out probably tomorrow and over the weekend if we have any positives. And then with the holiday next week, we're going to be testing next Thursday and Friday. The DO8 stats, recent numbers, total number of facilities with positive cases is 1,094. Total number of positive residents across Pennsylvania was 26,721. And for the resident deaths across nursing homes in Pennsylvania was 5,851. And then the last page, that was it. Oh, the case mix. So that page explains what the case mix index is. So you have your Medicare payers, the percentage during the quarters. So quarter 1 through 3 was 85% Medicaid. Medicare was 8%, and other is 7%. And you can see at the bottom what the others were, which is private pay, the VA, and then miscellaneous, which could be other insurances.
Any questions? Mr. Hackman?
Is this smaller than we usually get?
It was. The numbers in the beginning pages didn't change because of how we met from last month, so we thought we'd just condense it.
Oh, okay.
And then it should change next month. You'll have those first pages included.
Question, all right, the follow-up I have is, does the state still have the regulation in effect where if a COVID positive person, you would have to admit them, correct?
Correct, but now they went back to where the hospitals must provide the COVID test before they come in to make sure that they're negative. Because for a while there, they stopped it, we weren't taking them, but yeah, now they went back to where they are going to provide those results to us.
But I mean, if somebody needs to come in and they are positive, we still have to accept them, correct?
I have not at this point.
I mean, if they qualify in every other way. Oh, okay.
Yeah, right. So what we
Oh,
do.
all right. I mean, I wasn't, at one time, am I mistaken that?
In the beginning,
governor-
during it, yes, they
or the
were telling
Secretary of
nursing
Health-
homes.
All right, so that now you're not bound.
Correct.
I mean, I'm not saying that whether what's good or what's bad. I was just, because I know we still have our isolation wards set up. We're not going
Correct.
to do anything with that yet.
Correct. And we quarantine, so any new admits still get quarantined.
Okay, well,
We follow that protocol.
you answered that. All right, thank you. That's it for me.
Any other questions? All right, well, I had questions about the dementia units. I don't know if you want to talk about that or, and only because I guess I'm starting to see or hear from different families who have that. And like you said, it's maybe a pre-planning issue that people are getting like diagnosed at, in their 50s or 60s with early onset, or they haven't fully progressed, but I wanted to hear more about the unit.
So
And just what kind of cases that you have there? Are they all elderly? Are they mixed ages, ranges?
So we have the two alternative care units, and that is Tower 3 and Tower 9. So that is where cases of dementia are pretty bad. So somebody could have dementia but be on any other floor. It is where maybe you get to a certain point where you need more specialized care, more activities, more direct care are then on that floor.
So at what point would you, like if I'm a family member, I'm a constituent, and I say, well, I'm not sure when to bring them in, or at what point, you know?
So what we do is when they come, because we get phone calls like this all the time, we don't know what to do with mom or dad, or even husbands and wives, I don't know at what point. And then we usually say, go talk to your primary care physician, since they know them best. Send us the medical records, we'll review them, and we'll go over where they would likely be beneficial, whether it be a dementia unit or, another floor that's maybe secured unit. Because again, there's different stages. Somebody may be fine and then 3 o'clock hits and then they become confused. So you may not want to put them directly on a dementia unit where there could be confusion.
And are they
before
at
they
risk
had
for elopement? Like, do you have elopements from that?
We-
Because I
we
think they
have-
forget, like, I think I parked my car in the lot and I'm gonna go get it. Like, and I'm not even joking, because like, that's the kind of stuff I hear. Like, the family took the car and it's like, well, I'm gonna go up there and get it because I forgot that I'm not driving for like a year.
Well, and we do assessments. So you have to do an assessment in order to see the elopement risk factors. And then once we assess those, we look at putting what's called a watchmate on them. And the watchmate, well, it's just a bracelet that goes on their wrist, sometimes on their ankle, and it shuts down the elevators and then sends an alarm off, so they can't get out.
Okay. Is there anything else that you need to share with us, or, I'm just gonna have people call you when they need it, because I do anyway.
And I always tell them, we work for the county, so people can just call us if they just have questions about their own, what's going on in their home, and we can direct them either to aging or to the VA, wherever. We refer people all the time throughout the county.
I guess I would classify this as more early onset cases, because I think of, like, when I think of my mother, she was an elderly dementia, natural progression of age. This is people who, like, in their 50s and 60s are
We have
really
young.
starting to be identified. And then I guess you see, it kind of goes in spurts. We have good weeks and then really bad, and so.
Right, and
I
it
just
could go
wondered if that
quick
would
or
be
it could go
appropriate
slow.
referral.
Yeah, they can just, and we'll talk them through the process and tell them where your best is. Because especially if children are not living with their parents, and in the early stages, it's very easy to disguise it because they're very structured. Don't look at my checkbook, don't look at anything. And it's not till you start getting phone calls from maybe the neighbors. We've experienced this in our own house, the frequent falls, the confusion getting out of the house at night, that then families start to go, okay, now we got to go back to see where mom is. And then what do we do? Because nobody gives you a book when things start to happen. So they start making phone calls. And usually Grace-Dale is one of the first calls.
Okay, how are we doing with staffing? And how have we done, because I haven't asked in a bit, we did put recruitment strategies in.
Okay.
Are you going to address that
Yep.
during? Okay. Go ahead, Mr. Heckman.
As she was talking about this, I just thought, where are we at now with our Alzheimer's units for men and women? What's our capacity at this point?
So right now, we have one full dementia unit, which is all women. And then we have the other dementia unit, which is men, and it's 3/4 full.
Could you give relate that to numbers so everybody knows?
So 50 beds on a tower unit. So the female unit has 50 female occupants. And then on the male dementia unit, it's 30.
And, I mean, you still have is there a differential for staff, and also they have to rotate as far as the Alzheimer units go? Because I know the burnout rate, as you know, I mean, especially with the men,
Right.
it's just, the stats will back that up. So there's nothing sexist. The fact is, the men's unit can get wild. And I just wondered, there is that, like, staff was handled a different way with Alzheimer's.
It is, everybody has the same training. If we see a need, then we add more training to it. We, back in, before COVID, in the fall, we had one of the hospices come in and kind of give a perspective of what it was like to have dementia. So, you put Vaseline on goggles, you put corn in the gloves, and you kind of get that, you have earphones on that are blasting music, and then you have to accomplish a whole bunch of tasks. And you get that feeling of, wow, this is what they're living with, the voices, and you can't see clearly, and you're trying to put food on a table, or you're trying to get dressed, and you come out and everything's askew. So we try to involve those
So
things.
you watch, I mean, you keep an eye on the staff that are doing Alzheimer's unit work, because, I mean, it's stress, human service work can be stressful in different areas. And sometimes some of the people in some of the most stressful areas don't even realize how stressed they're getting.
Yes.
And I know Alzheimer's unit is one of those burnout places. And
It
sometimes
is.
the staff person themselves, like, don't even, they like, hey, you know, you've had some issues lately. You're getting pretty irritable, some of these people. They're not abusing anybody.
No.
It's just, they don't even realize that it's weighing on them.
And we do, and we have support there with supervisors. We have a great HR team. You know, we have the employee portal that they can talk to somebody, and we do. But I'll tell you what, like every staff member at Graysdale, the dementia staff love their residents. They wake up every day and they're like, let's get to it and see what we can do. The staff is great across the board.
Anything else? All right, thanks.
All right.
Thanks for everything you're doing up there.
Have a good night.
Ask them. Us too. I thought we approved it. We're mumbling.
It's okay, I'm
They're
waiting.
getting hazard pay, correct? We approved hazard pay.
Yep. Ready?
Yep.
I don't have a huge agenda. I also feel like we've been here regularly with we had a bunch of programmatic questions at the budget hearing that we got through. So I have a few things tonight. I'll start with Graysdale and the recruitment. And I told Jen I would talk about it because probably about 4 months ago, I asked to start having regular meetings with administration and HR, because we knew that our HR was doing everything possible to recruit, but I just like to have all the details whenever possible. And so we decided to start meetings so that we could make sure we were staying on track and measuring how successful different efforts were, so on and so forth. And we just had our last meeting, I think it was last week, although the days certainly have blurred. And I really cannot understate how impressed I was with the volume and quality of efforts that are being undertaken to recruit at this point. And we're fortunate in that some of the CARES money is specifically intended to be able to use for hiring additional staff. And there's all sorts of ways that you get to that justification, but specifically that is one of them. And so we've taken on some things that we wouldn't normally otherwise do because of maybe not a large recruitment budget. So we have radio ads going. We have 2 billboards at least. I know there's one on 22 East. I believe it's right after 191. I see it almost every day on my way to work. That Graysdale is hiring, full benefits, and $1,000 towards CNA training. And the other one is, I want to say on 248, but I'm not 100% sure. Tomorrow, one of the media companies that we utilize is coming to do filming for a commercial, and we purchased the largest package, which was still very reasonable, for the volume of the ad running on local TV. So look for that in the upcoming near future. So once we shoot it, we'll take a look at it and make sure it looks okay, and we're excited for that. They did one virtual hiring event through Indeed, and we've purchased all sorts of additional kind of upgrades through Indeed to have them assist us. So I know that they did hire several people off of the Indeed virtual hiring event, and they are doing that again. In fact, the critical focus is on twofold. One, dietary, and the other one is LPNs. That's where we tend to use the most agency staff, and we're working really hard to bring those numbers down significantly. And Victoria Bunn is our recruitment specialist over at Graysdale, and she does a lot of just individual follow-up with folks on the phone and contacting people directly, and if they've applied and interviewed and we haven't heard back, following up to find out why they didn't take a job at Graysdale. And I don't know where the LPNs are all going to work, somewhere in the Lehigh Valley, although that was a bit of a surprise after the COVID and all of the layoffs. But so that's our focus right now. They've done a ton of email blasting through Monster and are going to expand the outreach. There's a geographical radius, so they're going to expand that a little bit, and also dip down like right into Jersey, since we're not too far from there. And then one of the things Jen suggested at the end of our last phone call was, what about the individuals, adults with developmental disabilities? Those are oftentimes the individuals who work very well in the kitchen staff, and that's what we were talking about in particular. So I reached out to our developmental program folks, and actually I can't tell you how thrilled they were that Graysdale thought of them, and they have a whole lot of contacts throughout the Lehigh Valley with VIA and SPIN, Private Industry Council of Lehigh Valley SIL, the Center for Independent Living, Colonial IU. So we have kind of, just like we had done in the past, we sort of made a connection between Graysdale and Third Street Alliance, which is a women's shelter. We've now expanded that to include some adults with developmental disabilities who there are definitely jobs at Graysdale that they would be fantastic at. We've also, Victoria also reached out to staff at New Bethany Shelter and is also connecting with them on the CNA training program and some different jobs. So we are always open to ideas and suggestions, so if anybody has any, we certainly will take them, but it's just, the group effort has been tremendous, and I'm really pleased, and, we're slowly seeing some fruits of the labor, but they're giving it everything they have, that's for sure. Any questions on that? Okay. Ms. Fargo Hefner, you have asked in the past about numbers, I think specifically wondering how drug and alcohol referrals are going, especially in light of COVID, we've talked about it. And so I asked Beth Miller to provide me some numbers about those who've been assessed and receiving inpatient or outpatient treatment. And I won't give you all of the numbers because they're somewhat meaningless, but the amount of individuals who are being assessed and going to treatment are about half of what they were, like if I look at September of 2020 compared to September of 2019, the numbers have dropped significantly. And, frankly, we know it's not because there's not substance abuse issues, especially with COVID, but the biggest fear is, especially related to inpatient treatment, is folks not wanting to go because of the fear of COVID and being hospitalized. So I do expect those numbers at some point will creep right back up and then some, but I just thought that was really interesting and wanted to share that with you.
Is there dropout because of it being virtual? Because obviously that's regarding inpatient, but, partials and IOPs are still providing services virtually. So I wonder, are people not buying into that? Or?
I'll ask that specifically, and it's actually really interesting because our friends on the Suicide Prevention Task Force from St. Luke's and Lehigh Valley have both told us, although I had more specific data on St. Luke's, that their no-show rate for behavioral health services, virtual behavioral health services, the offering of virtual behavioral health services has drastically reduced their no-show rate. Mm-hmm. It was I don't know, it was huge. Most people were attending their virtual therapy sessions. It was a significant improvement. So I would be inclined to think the same would hold true for drug and alcohol, but I don't, that's speculation. So I'll look into that. But we do know at least, thank God that for behavioral health services that those individuals are not only getting treatment, but at a higher rate than pre-COVID. So. Other questions about that? The only other thing I really wanted to talk about was our aging folks again. I know we mentioned, I don't know if it was at the budget meeting or the one prior, the work that, well, Lori Greco was here, and we were talking about all the work done in protective services. And as most of you know, when Lori started and I got here was same time, she inherited a red rating from the county, or from the state, I'm sorry, which was the worst rating that you could have. And we were in really rough shape. So one of the things that has been the new Secretary for Aging, Robert Torres, like many of you and myself, is very focused on data. So they've created all different sorts of data reports that they provide weekly to aging, and so they're able to stay on, it's just another tool that they can help stay on top of things quicker. But Lori sent me some of the information, and I had to share it, if you will bear with me just for a minute or two of numbers. Reports of need. What Lori went through and totaled the number of missing reports from previous 4 years. So for fiscal year 16-17, I'll just kind of rattle through this quickly, and then if you need me to repeat it, I will. There were 31 reports missing in total. 17 and 18, there were 89 in total missing. And 18-19 is when Lori started to take over and brought that number back down to 33. And I am really proud to say that for fiscal year 19-20, there were 0. So it was a mess, for lack of a better word, and she's continued to do a tremendous job. And there's another aging report, same thing for missing responses, dating back to 16-17, went from 28 to 152 in 17 to 18, and when Lori took over, that dropped down to 53, and 19-20, 0. So she has just done, and her team have just done a tireless, tremendous job. None of us are perfect, but they are knocking it out of the park with making sure that things are getting done and not missed and not falling through the cracks, and I'm really proud of all their efforts.
Are the 18-19 numbers carryovers from the year before, like just things they didn't get
No.
to, or these are new
Yep, new.
reports?
Correct, all new numbers. The other stats for aging are Lindsay Thomas is our Protective Services Supervisor 2, and she just was on a state call or a regional call on Wednesday, well, yesterday, actually. And they were talking about compliance rates for face-to-face visits being done timely and 20-day cases, which refers to cases being done within the 20%, or I'm sorry, within the 20-day time frame. And Northampton County was 93% compliant with face-to-face visits being done timely, 90% compliant with the 20-day time frame, which I have to admit, I was like, that's not good enough. And because I just would like them to be 100. But as it turns out, there's only one county who had performed better than us by a small amount. But the interesting average to compare it to was for the rest of the region or state, they achieved an 86% average. So we were still outperforming every other county except for one, which I'm assured we will outperform the next time. So. And you know, poor Philly, who struggles forever, their compliance rate was 68%. So
like you have a competition going with
yes,
another county?
I mean, I might be a little competitive.
They don't know though, do they?
No, they don't need to know.
Good for you.
So, and
How's the
Lori
house?
shares that too, that enthusiasm to be the best next time.
You know, we can't thank her enough. I mean, I tried last time she was here, but we can't thank her enough for everything she did, cleaning that up.
Yep.
How's the house? Because I don't remember the letters. LTSR?
ORLTSR.
Yeah, how's the house?
Well, Mr. Myers isn't here, you have to ask for him. It is, we're still with permits. I asked Tiff again after the budget meeting when I talked about the permits briefly, and in fact, that is where we still are. So it is out of the county's mental health and health choices folks' hands at this point.
I had one question to double back to regarding the LPNs. Is that a state requirement that there be LPNs, or is there ever a thought about replacing them with another level of service? Somebody like higher than a CNA, but not quite an RN, because I don't know how many people are actually going for just LPN training, and I'm wondering if
Right.
that's like the gap in service.
No, it's CNA, LPN, and RN, so.
State mandated.
Yeah, so the alternative would be to have more RNs, and that's way more costly.
Right, no.
And not
Because,
necessarily.
hospitals have what they call the technical partners or whatever, so they are people that are trained to do some of that nursing stuff, but,
Okay, I'm not familiar with that, but I know
No.
those are just the
or
three
maybe they call it,
categories.
it's just another name, they're not all LPNs, but
But we
you answered.
We did also partner with, I think Lincoln Tech, and there's one other recently that does some of the CNA and LPN training, and I forget which one's which. But Victoria already has on her calendar, both for NAC, for Lincoln Tech and Falcon and a couple other places, their last week of their classes for CNA training, because other places do offer it, and people have to pay for it. I'm never quite certain why they end up there instead of at Graysdale. but-
Warren and Raritan have programs.
Okay.
I know that's
Well,
on the
there's-
other side of the river, but
okay.
it's close enough
That's
to get
correct.
to.
So she's already on her calendar to go either virtually or in person to those classes to recruit for Graysdale upon near completion. So we're hitting up every angle we can.
Civil service,
Oh, yes.
sure, because Lamont's standing up, so you have a little time.
Before you get into civil
Sure.
service, you're right, we'd ask a lot of programmatic questions at the budget hearing. It was good, it helped people understand the money and how it flows.
Sure.
Did you say, and I wrote it down, but I'm not sure if it was accurate, there were no cases of COVID over at your building?
I think what
For
I said.
employees, I mean, the employees. there's
Sure. I think I stammered a little on that because as I was answering it, I could not recall exactly. So I did find that out though, Mr. Heckman. In fact, anyway, we had one staff person test positive back in May, but the person had not been in the office. And so, and it was a personal exposure. So that was somewhat of a moot point. The person's healthy and fine and recovered. We had, the one I wasn't sure about last week, as Mr. Myers asked me that question, we did have one staff person whose significant other had tested positive, and she subsequently at some point tested positive, but had not been in the office the days leading up to that. She's recovered, she's fine, she's back to work as far as I know, and that is what I know. So
as of now, we don't have any that you're aware of.
no, we do have people in quarantine.
Yeah.
The Julie Bader, having the largest staff with CYF, keeps track of her staff. Frankly, they're the ones who have the most risk of exposure, given the nature of their work. And the overwhelming majority of folks who've had exposure have been in their personal lives, not through work. But when they do have a work exposure, they quarantine, they call their doctor, and we follow whatever the doctor tells us to do.
I mean, but if you're aware and they have it in personal life, they would have to get tested or stay home. I mean, they can't come into work.
No,
Well,
definitely no.
Yeah, wherever they may pick it up, I mean.
But yeah, it doesn't, I just mean, we are fortunate in that.
It wasn't acquired in the building.
Correct.
Right, okay.
Correct.
And we're not
Or with a
aware of,
client
we're
or-
not aware of anyone who's in the building now that
No.
is tested
No.
positive. All right,
They
that's fine.
sure better not be if they've test positive, Mr. Heckman.
I mean, and look, we all know a lot of this is the honor system. I mean,
Sure.
you can't know 100% what people are doing or not doing. But I just wondered, based on your knowledge, because
Temps
I
are-
remember
temps are
this
still
came
being
up at the
taken
budget
and-
hearing, and I didn't remember.
Yep, no, temps are still being taken. In fact, we have one unit, when somebody in their division gets a cough, she's on the phone with HR, and so
Yeah.
there's a lot of self-policing as well. I have not seen anybody at work who is sick and symptomatic and should be at home, so
Yeah, all right, thank you.
you're welcome. You want to take that, or you want me to start?
You can start.
So civil service, we have hit a roadblock, a large roadblock. Some of the reason for the continual back and forth is, I think I mentioned the voluminous amount of information that our HR folks kindly shared with them, and it just has taken them so much time to weed through it all. So we really were like this close to the finish line, and they had questions with the Personnel Appeals Board, because civil service requires, there's all language to go with it, but objective sort of arbitrators, if you will, if someone's maybe appealing a termination. And of course, our home rule charter, that mechanism is the Personnel Appeals Board. And civil service, the reason we're at an impasse at the moment is civil service feels that there has to be someone who's not affiliated with the county. So in a nutshell, there you go.
So, counsel, for me, it's an impasse. I can't suggest to you that you amend the home rule charter for this purpose. The reason for that is we've been living under the civil service system, which is onerous, for sure, for many years. And I see no reason why we would upset the framework that those who founded our charter established for this purpose. So that's a sort of a broad thinking about the subject matter. Potentially, you could come short of a home rule charter amendment and maybe pass an ordinance very similar to the Article 13 exceptions for the courts and human services, for example, so that they did not have to, for their career service people, they would not have to go through the personnel appeals process and end at the Personnel Appeals Board, but could go to an outside arbitrator. But I have two major problems with that, in addition to the fact that it is, potentially violative of our charter without a charter amendment. My major problems are I do not believe that's in the best interest of the taxpayers of Northampton County to potentially expose them to arbitrators who at least facially are objective, but very often when you see things go to arbitration, you can see things get quite out of hand vis-a-vis the determinations that are made and could potentially have profound impacts for the taxpayers. That's why I think the folks who wrote our home rule charter created the mechanism that they created, giving counsel and then doing it, creating the career service apparatus and rules and regulations that it created, and then establishing the Personnel Appeals Board, which would be appointed by the county executive and confirmable by Northampton County because it's the founders of the charter who determined that it was in the best interest of the county, even though the Personnel Appeals Board sits as a quasi-judicial board, it was in the best interest of the county to have those disputes rectified in that way. I see no reason today to expose the taxpayers to increased liability. These folks, they sit as quasi-independent. I don't ever talk to them about the decisions they make, the testimony they hear. They have a solicitor. They do their own work, and I don't, at this point, think that I would recommend making these kinds of very substantial changes to our mechanisms for this particular purpose. The second problem I have is if we carved it out for career service employees at Human Services, it would be very unfair to the rest of the career service employees throughout Northampton County. Now, the vast majority of our employees are in a bargaining unit, but we do have many, many hundreds of career service employees, and some of whom would be then in a disparate system. You'd have one smaller group of employees who had this right, if you will, to go outside to have their grievances heard, and you had another group of employees that would still be coming into the personnel appeal system. So for those two reasons, I wouldn't recommend to you that we do that at this time. What I would recommend, and what we are trying to do with help of our outside labor counsel, is convince the civil service that we have a process that that works for everybody. And because you do have, if you don't like the Personnel Appeals Board decision, and this happens all the time,
You have the right.
you can appeal it to the Court of Common Pleas.
So I guess, the question is, how far have you gone with that explanation to them?
Well, so we have
Sorry, I know you have to.
Okay. No, we've provided them that explanation, and
the person in civil service who is reviewing everything for us, she's like, once she gets all the boxes checked, she sends it to DHS at the state level to rubber stamp it. So she took that issue up with the Department of Human Services at the state level, and we are patiently waiting to hear back from them.
And the only reason I ask that, and I'm thinking, is, you know, I've been here for how many years? I know we have a personnel appeals board. We've never talked about it up here. We've never asked them what they do. So, I mean, I don't even know who the members of it are. So you can't get more independent than that.
You know most of them, you voted to approve them.
Yeah, but that doesn't
And I
mean I
think you-
could sit here and name them today, you
Well,
know?
You do know, I can tell you, I believe you know most of them personally.
Oh.
But we don't want to go through the list, do we? Because I'm afraid I won't get all 5 of them. But that's the real reason I don't want to name them all. But I think as a sort of tangential point, we found this in a different forum not too long ago, much to our chagrin. Most folks in Pennsylvania who don't live under home rule and don't understand it. And we have a really difficult time explaining home rule to them and what the differences between home rule and the traditional county government organization are. They don't know about the Home Rule Act. They don't know about the provisions in the Constitution, and frankly, most of our 67 counties don't care about home rule. They just don't. And so you run into that at every, we run into it in the courts. We're running into it in the state bureaucracy, and most of the law that's been made on all of these issues through the years have come out of the traditional commissioner system. So they're not even applicable. Their county code, they base their decisions on the county code, and they're not even applicable to us in many instances. So it's a very difficult situation. But at this time, I would not recommend making that substantial change for all the reasons I've said. So I hope they see it our way.
Do we have a lawyer that?
We do.
Who's our lawyer for?
Our
the
outside
personnel?
labor counsel from Eckert Siemens is working with them on that.
With
Oh,
the civil service?
Yes.
Yep.
Yeah. We're not terribly optimistic, though, that we'll be able to prevail upon them.
Okay. Go ahead.
Is part of the issue, civil service may be concerned because it takes it out of any way, shape, or form the county's hands as far as the employees, and it's totally independent from the county because it's run through the state. And that even though you said, you're not discussing, and that's how the boards usually work, but they may be thinking, well, yeah, but the optics are, you appoint them, we confirm them, and so if the employee goes back under our new civil service, that may compromise the process.
I may even be able, yes. The answer is yes.
That's what I'm.
But I may even be able, I would maybe even be able to live with for you, having their appeal go to the Civil Service Commission.
Yeah.
But I cannot recommend to you that we open up a Pandora's box of independent arbitrators, retired judges and the like, to hear your cases. That is not, and it is, one, it's my concern for the taxpayers, but two, it's, the people who wrote our charter, they understood all these things. I mean, they understood these things, and they wanted, they took advantage of the home rule law such that they could create, and council in the early councils could create a career service regime mechanism that it was in the best interest of Northampton County's residents.
Well, I'd give it one more try.
We're doing everything we can. I can promise you that. It was a.
Yeah, and just, Ms. Argo, you hit on it. It's that appeal to the Court of Common Pleas, which then has appellate, we're in the appellate courts right now on one of these cases. So it isn't as if the employee doesn't have an ability to redress these grievances in the courts. And that's what we're trying to explain to civil service now.
And there's issues of turf. Bureaucratic turf, at the end of the day, you're stepping on my turf.
Well, again, Mr. Heckman, if civil service came back and said, we'll settle your final disputes, we would say, okay. What we'd be fine with, but that's not what they want us to do. They
Yeah.
want us to hire arbitrators, and
Yeah,
that's,
I get the sense they just don't want to do it. I mean, they're making it as, almost as impossible as to say yes as it can be, because ultimately,
do you have that sense?
No, actually, Mr. Heckman, I don't. I think the sense that we've all gotten in the last 2 years is that civil service wants as many counties out as can,
Us want to go.
as one, and can manage them, all the functions that civil service would normally manage.
how many counties have gone out so far?
I think I have a ballpark, but I'll find that out. I don't want to give you the wrong answer.
Okay, just curious.
Okay. That's all I have. Anybody have?
Wasn't Berks County one of them?
Yes.
They were the model
Yep,
that we were
absolutely.
kind of.
Berks County, Bucks County, yep.
Bucks, okay.
I was going to ask if we could hear from somebody from the board at your meeting, just to get a sense of, because even, how many cases are heard there a year? How many of them were settled in favor of the employee? All that kind of stuff might be helpful data for them to have.
Just quickly, one of the things we did earlier this year was we added caseworker positions.
Yes.
Any progress in filling those? Could you update us on that?
Yes, and I actually was not, honestly, Mr. Cusick, expecting to be able to fill some of those this calendar year because just the nature of how things take time. I can tell you that our Assistant Administrator, Kim Kickline, I think has only been interviewing nonstop for weeks and will continue to do so. I don't have the exact numbers, but I absolutely can tell you that I have had plenty of the PAN forms come across my desk and emails introducing new staff. And one of the things that I'm most excited about is because of the nature of COVID, there's been a lot of layoffs in the community, and so we will be the benefactors. I think the last 4 or 5 caseworkers that I've seen that are starting at Children and Youth actually are coming to us with experience, which is not typical. And so hopefully those folks know what they're getting into already, and maybe that will help with some of our retention. They already know, and they'll stick around a little bit longer. And they just obviously have more job knowledge coming in, so.
and we'll get you those numbers.
Yep, absolutely. Sure.
Any other questions? Then let's adjourn the meeting. Thank you very much.
Did you say Clary's not coming tonight? Not to the 6:30, okay. Okay, thank you.